Cool. Well, friends, we are in for a treat today. We get to hear from the Dr. Helen Lavresky, who has done so much work in this field of integrative psychiatry. She's a professor in the Department of Psychiatry at UCLA and a geriatric integrative psychiatrist with the federally funded research program in integrative mental health using mind body therapies. She has received several research development awards from the NIMH, the NIH, the NCCIH, and other prestigious awards. Her current research studies include investigation of novel therapeutic options for mood and cognitive disorders in older adults and for long COVID, which we certainly need lots of research on. She is the Distinguished Life Fellow of the American Psychiatric Association, the American Association of Geriatric Psychiatry, and the Fellow of the American College of Psychopharmacology and the American College of Psychiatrists. So certainly very dedicated in our field. So many contributions in her research. She's most recently published a book that we'll make sure to put in the chat here. And she is the director of research for the UCLA Integrative Medicine Collaborative and leads several research programs and clinics. She's the immediate past president of the American Association for Geriatric Psychiatry and serves on the Advisory Research Council to the National Center for Complementary and Integrative Health. She's also a consultant to major health and governmental organizations nationally and around the world, including the American Heart Association, the AARP, and the National Council on Mental Wellbeing, and others. And so we are so excited that Dr. Lavresky could put aside some of these really busy time in her schedule to talk with us about mind-body therapies for resilience and brain health and aging. Thank you, Dr. Lavresky.
Right. And soul psychiatry, as it might exist, as I understand it, and I just wrote a book that is available for purchase. It's coming out in July 7th, on soul psychiatry, Living from the Soul, the Neuroscience of Spiritual Awakening. So I've done a lot of research, but I actually draw a lot of satisfaction from teaching this practice to patients in my clinic, to patients who are open to that. So in order to participate in this meditation, which is soul listening meditation that I'm going to show you, introduce you to, the only prerequisite is to be open to the possibility of soul's existence. Nothing else is needed. You could be skeptical, but curious, just open enough to engage in this meditation. And so let me invite you to close your eyes and start breathing through the center of your chest, heart breath, sending your breath through the center of your chest and deepening your breath, controlling it enough, but also letting the breath take over your body. Send it to places that are tight or in pain, asking them to relax. Send your breath and the blessings to all places in your body that feel tight. Relax them. Now imagine solar disk or sphere inside your chest, and it's a sphere that is filled with golden liquid nectar quality light. So it's a sun inside your chest. And continue sending your breath through that golden sphere. If you do deep breath through that sphere, and with the next breath, send it to the places that feel tight and in pain, sending your breath plus this golden liquid nectar light. And bless those places. A few deep breaths through that. Any pain, discomfort in your body, dissolve in that light and your breath. And now we're going to be going through your body, kind of blessing all of your body from the top down. You can start with your scalp and send that golden liquid light and your breath to the scalp, relaxing every single hair follicle on your head. And now imagine your skull being a chalice, a very encrusted, very rich chalice encrusted with gemstones, and fill it up with that golden light and your breath. From the top down, structure by structure, cell by cell, your entire brain is now bathing in that light and relaxing. The next chalice are your eye sockets. Fill them up, same way, from the top down. All structures slowly fill up until it runs over. Relaxing your eyes. Your ears, same thing. Another chalice to fill up. And your mouth, oral cavity, the entirety of it, all tissues, supportive tissue, your tongue, muscles, your gums, teeth, the entire mouth is filled up. And your entire head is now filled up or going into the neck, the brainstem, and 7 vertebrae, C1 through C7, top down, relaxing your spinal cord and all tissues of the neck, thyroid, parathyroid, pharynx, larynx, all filled up. Your entire neck is filled up, going to the shoulders and into your next chalice, your chest cavity. From the top down, fill it up, your entire lungs from the top down. Cardiovascular system, heart, all chambers, all major veins and arteries. Bronchi, alveoli, all filled up to the diaphragm, all tissue, supportive tissue, and chest cavity, as in all ribs, intercostal muscles, supportive tissues, and spinal, the thoracic spine, C1 through T1 through T12, from the top down, spinal cord. And the diaphragm muscles now are all inundated with this golden light, and your breath relaxing into your abdominal cavity, blessing your diaphragm. And the next chalice is your abdominal cavity, all organs of abdominal cavity, starting with adrenals that are very, very tired. Blessings and golden light to the adrenals, kidneys. Kidneys hold your fear, emotional fear. Pancreas, another negative emotion, anger and grief, and liver, anger, rage, sometimes ancestral, and gallbladder. And the GI tract, the entire GI tract, your stomach, swollen intestines and colon, peritoneum, and then lumbar spine, L1 through L5, and sacrum, going into sacrum. The entire abdominal cavity is filled up. Now, the next chalice is your pelvis. All organs of the pelvis, sex organs, and bladder, ureters, filled up. Blessings. And now to your musculoskeletal system and supportive connective tissue. Bone marrow. Inundate your entire bone marrow with this golden light. Your shoulders, upper arms, elbows, forearms, wrists, your hands, until your hands are dripping that golden light that connects you to the center of the earth. You're now connected to the center of the earth. And now hips, pelvic bones, hips, upper legs, knees, lower legs, ankles, and the feet, same thing as in hands, dripping down to the center of the earth. So you're now connected to the center of the earth. And at this point, imagine your connection to the sun of our universe, our solar system, not the universe, solar system, then universe, central sun. And you're becoming that chalice yourself, conduit of golden light connecting earth to heaven, to the sun. You're this conduit And in this expanded sense, that is no longer just your physical body, you can talk to your soul on your behalf of all 13 of you or 18 of
Thanks
you.
amounts.
Okay. In this expanded state, can you please connect with your soul? I'm going to ask on all of your behalf. Soul, are you there? And listen to this intuitive connection to the answer, to the sensation that might present intuitively. And if you feel any connection, we could discuss it, how you felt that. You could use it in your future connection with your soul as a sign of your connection. It's like dialing in, soul, are you there? And once you feel that connection, you could have a conversation with your soul. And again, listen intuitively to what presents. The first thing that pops in might be that answer. You could cultivate this connection with your soul via this meditation, soul listening meditation. And the one request that I would make that is, I find extremely universal, is to ask your soul to give you a hug. Feel your soul's hug. Our collective souls connected in this session. And feel your individual and collective soul hug for the group and for you individually. And again, register the sensation. Some feel it as cold or hot or the actual hug. So blessings to the group. We could now open our eyes. It is helpful for patients to realize that they're never alone. In fact, in hundreds of people, especially the caregivers, the first group of patients or participants in my study that I introduced to this meditation were dementia, stress dementia caregivers, mostly women, but some men. And the majority of them cried at the time when they felt hug. And this happened almost 20 years ago. And that alone just posed, and I didn't expect anything. I just was practicing this meditation with them. But the fact that all of them cried, and there are stoic people, there are caregivers, they deal with a lot of stress, posed a question to me about this universal connection and that cry, and trying to interpret what it was that made them cry. And I think this was, how caregivers feel very alone sometimes. They are between providing care for their children, for their parents, for their spouses, and they don't think about themselves. This was their moment, when they realized that they were never alone and they could resort to speaking to their soul and seek guidance and feeling hug, because nobody else was hugging them. And that started me on this journey. So let me just share my presentation with you. All right, so I'll talk a little bit about my work with mind-body therapists and brain health. This is my recent passion. I write a lot about brain health across lifespan, where spirituality and mind-body therapies is a tool. This book is coming out, Living from the Soul, the Neuroscience of Spiritual Awakening. But I'll talk about the role of Tai Chi and yoga and mind-body therapies in treatment and prevention of late-life neuropsychiatric disorders and mechanisms of response. And also, is there time for whole person health, brain health, and soul psychiatry? So I work in this situation where the population is aging. The majority of people born over 65 is like skyrocketing, and children born under 5 is going down. That means within 20 to 30 years, we're going to run out of caregivers. So we better off position ourselves in being more independent and also producing a lot of robot caregivers who will take care of us. This is the mass disaster response in the population, mostly studied in climate-based mass disasters and also applicable to pandemic and other mass disasters. So that means that pre-disaster we function at a certain level, and when the impact hits, in pandemic it was March to June of 2020, there's a honeymoon or heroic phase where most deaths occur, but people also mobilize themselves. They stand together. Like if you remember, Italians were singing operas to each other from the balconies, and in America, neighbors were helping neighbors, applauding line workers. But then when stress sets in and continues, disillusionment sets in with new viral loads and viral variants, and it continues 3 more years of pandemic. And we're currently in this reconstruction phase, except we can't reconstruct because we're being bombarded by new mass disasters, climate or man-made. So this presents the model of stress. I'm sure you are all familiar that with the fact that our body are built to withstand stress, especially acute stress, and adapt through this change by changing physiological responses, that could be modified by our genetics, our individual experiences of trauma or stress, but also behavioral responses, choosing our lifestyle like diet, exercise, sleep, substance use, alcohol use, all shape physiological responses. But when stress becomes too much or too long, we develop maladaptive reaction or allostatic load with all sorts of systems running into this fight or flight response, with increased cortisol, increased blood pressure, increased insulin resistance, hyperlipidemia, inflammation, also effects on the brain with hippocampal atrophy and prefrontal cortical thinning that could manifest as mood and anxiety disorders or memory decline with reduced attention. And then sleep suffers, chronic fatigue sets in, impaired wound healing, and decreased physical and mental resistance result in cognitive fatigue, impaired recovery from immune-mediated disorders, and reduced health span. Mortality will increase. Like in dementia, caregivers have 60% higher mortality compared to peer non-caregivers. With respect to brain, it creates aging alone plus cumulative exposure to stress creates cerebrovascular disease, neurodegenerative changes, and chronic inflammation. And under stress, this vulnerable brain can deep into depression or cognitive decline unless we set these resilience factors that may be social support and participation, physical and cognitive engagement, dealing with stress, stress reduction, and building brain reserve. The resilience psychological and emotional resilience refers to the ability to recover from adversity and stress, and has multiple domains: psychological, emotional, cognitive, motivational, physical, and social. And brain health is one resilience factor that can help recover from the impact or trauma. Lifestyle medicine, sleep, diet, exercise, and stress reduction, building social support, intergenerational relationship, all are known to improve resilience, psychological and physical resilience. So brain health across lifespan refers to risk and resilience factors that are known, like, for example, in early life, some of you are child psychiatrists, maternal nutrition, responsive caregiving, environmental protection from exposure could build resilience in early life, attending to early trauma in childhood, cognitive stimulation and engagement, teaching emotion regulation with mind-body training like mindfulness and yoga. In adolescence, finding purpose and wisdom, peer and adult mentoring, physical activities, sleep hygiene, protection from head trauma. In adulthood, sleep hygiene, nutrition optimization, mind-body training, and in senescence, in addition to the previous, also cognitive training, digital technologies, AI enhanced interventions, and so forth can build this resilience. Generally, all integrative therapies, mind-body dietary, physical activity, body-based, natural products, are known to compress morbidity and require fewer medications with improved side effect profiles as a result of that, but also have direct benefits for cardiometabolic, bone, brain, and vascular health, and also reverse, my studies have shown, and others, mechanisms of aging by improving chronic inflammation, senescence, mitochondrial dysfunction, telomere attrition, epigenetic alterations, and genomic instability. So Tai Chi, yoga, and Qigong, mindful exercise, I don't have to explain to you what they are. Non-competitive, non-judgmental, with mental focus on muscular movement and alignment, centered breathing with conscious breath, patterning, controlled breathing, and something we can measure reliably, energetic centric awareness of individual flow of intrinsic body energy, life force, prana, sekam, chi, or kundalini, all refer to the same intrinsic body energy. The best proxy for this is blood flow, because where energy goes, blood goes. So all of these practices can modulate brain autonomic nervous system, hormonal and immune pathways at different levels. For example, meditation and biofeedback mostly work on central and autonomic nervous system level. Acupuncture can work centrally and peripherally, and vagal nerve stimulation would work on autonomic nervous system. All will result in decreased stress, biology, and immune activation. So proposed mechanisms are through relaxation, decreased sympathetic output, reduced somatic symptoms, benefits anxiety, depression, blood pressure, recovery from immune diseases, reduces levels of inflammatory markers like C-reactive protein, improves immune function, vaccine response, reduces stress hormones of the HPA axis, oxygenation in the blood and brain, increased levels of endorphins, slowing of EEGs into alpha and beta activity, suggesting increased relaxation and attentiveness. And then lots of neuroimaging studies, including my own, document growing gray matter volumes in different areas of the brain. So breath and controlled breathing, conscious breathing is a part of these practices. That alone changes autonomic system balance, increasing parasympathetic system tone, decreases sympathetic system, and establishes calm and synergy in the body and the brain. Has direct neuroplastic effect on the brain. After 1 to 2 months of practice, minimum 5 to 10 minutes per day, documented improvement in lung capacity, cardiorespiratory health, oxygenation, inflammation, improved cognition, attention, relaxation, and decrease stress reactivity. It also synchronizes heart and lung outputs, but also in the brain, slowing in the brain and heart rate with slowing of the breath. And when breath is fast, like in the breath of fire, it activates, it increases HRV and activates brain structures, EEG. We did this, published this paper quite a bit ago when we compared neural mechanisms of mindfulness-based training versus yoga-based training, and noticed that these areas in the brain are affected: prefrontal cortex, anterior posterior cingulate, insula, which is center for sensory awareness, interoception, amygdala, emotional processing, and striatum were affected as well. So this shows what areas are activated in mindfulness: 4 areas: premotor area, mid-cingulate, angular gyrus, and primary and secondary somatosensory cortex. All can be used for treatment of mood disorders, anxiety, ADHD, impulsivity, and improve emotion regulation, but also self-awareness. In movement-based practices or yoga-based practices, more areas are activated simply because more elements of practice like movement are integrated. And these areas also refer to discernment, memory, language, visual, spatial, and somatosensory integration could be useful for treatment of impulsivity disorders, neurological dementia, cognitive decline, and caregiver stress. So all in all, we are all dealing with life, and we all have different predisposition and genetic and experiences throughout life. But if we plug in mind-body practices like Tai Chi, Qigong, mindfulness, or yoga, they change neurobiological mechanisms of stress response and aging and lead to more resilient mental and physical health and outcomes. So that's how Tai Chi, and I study multiple practices like Tai Chi and yoga and Qigong and meditation. So this is Tai Chi group. We did this first study a while ago where we recruited 112 older adults with major depression, 60 and older, and pre-treated them with escitalopram, Lexapro 10 milligrams for the first 6 weeks. And then partial responders who did not fully respond to the medication were randomized to escitalopram to receive Tai Chi Cha for 2 hours per week versus health education for 2 hours per week. And interestingly, both groups demonstrated improvement in severity of depression, but the Tai Chi group demonstrated improvement in resilience, energy, and psychomotor retardation, physical functioning, cognitive measures of executive cognitive function, attention, and memory. This is the depression on Hamilton depression score improvement in Tai Chi group more so, but health education also improved significantly simply because of social engagement during group activities. People just love attending groups and talking to each other. Mostly there are depressed, isolated older adults. So depression improves in parallel. But in Tai Chi group, more so statistically significant improvement than in health education. When it came to physical functioning, verbal memory, and C-reactive protein, they have a very different response in each group with improvement in Tai Chi, but not improvement or decline in health education. We followed it up with this more real life-like study where we recruited 220 patients, and they were already receiving some kind of antidepressant treatment, and that varied quite a bit with some psychotherapy or drugs or combination, some other practices. We asked them not to change it, but we added Tai Chi and health education program, similar protocol to the previously, just added to whatever they were doing. And that addition of Tai Chi was associated with remission rate, additional remission of 35 and 33% at 3 and 6 months. In health education was lower in 3 months, but then it caught up at 6 months. Tai Chi overall demonstrated a great improvement in general health compared to health education. And dropout and tolerability did not differ. So you could see that depression improved faster in the Tai Chi group, but then they kind of equalized by 6 months. When it came to the brain, the Tai Chi practice increased this connectivity between different areas in the brain, in the cortex. And that increased connectivity was also associated with improvements in depression and resilience. This sort of can explain why depression improves. Tai Chi group showed a reduced brain response to negative stimuli by these negative phases. They were not just reactive to that. Reactivity activation decreased when in health education it increased a little bit. We didn't find group differences in inflammation, measured multiple inflammatory status, but cytokines and chemokines, but remitters had a anti-inflammatory response. So those who responded with anti-improvement in inflammation achieved remission, but those who didn't respond or worsened in inflammation did not remit. So this is a yoga project in women at high risk for Alzheimer's disease. They are postmenopausal with subjective cognitive decline. They think that they're losing their memory, and they have one or more cerebrovascular risk factors like hypertension or hyperlipidemia or diabetes. And then they're randomized to Kundalini Yoga 1 hour a week, and Kirtan Kriya was a chanting meditation of about 11-minute duration as a homework, and memory training of the same duration for 12 weeks and 6 months follow-up. 1 hour per week and 15 minutes homework each. So here we see that yoga practitioners benefited from yoga in a reduction in anxiety and also subjective frequency of forgetting and seriousness of forgetting. So their subjective evaluation of their cognition improved, but memory training group improved in objective measures of delayed recall, but none of the other measures. On the brain level, women in the yoga group showed either no decline in these blue areas, no decline here, but the memory group declined in all of these areas over the course of the study. And left precentral and lateral occipital cortices in the yoga group increased in gray matter volume. Also, memory and yoga groups showed different changes in connectivity. Yoga showed increased connectivity in the anterior hippocampal seed in the default mode network, and memory training had increased connectivity in the posterior hippocampal seed to the auditory network and somatosensory network. And that tells me that if we combine the two, then we achieve more of a benefit in terms of increased connectivity in different types of groups. This is a study where I serve as a PI to examine. This is a adult aging brain connectome study that follows 1,500 adults, 36 to 110 years of age, over the course of 10 years. And we'll look at the lifestyle factors affecting their cognitive and brain health. And here, the most stable predictors here are actually motor function. So this support the need for more motor enhancement like exercise and mind-body exercise that would affect brain health and cognitive health with aging. The improvement was in left parietal cortical thickness and caudate nucleus involvement. So here is this meditation that we did in the beginning. We asked 10 volunteers that were young adults, mostly UCLA students, to learn that meditation that I taught in the beginning of this session, of this presentation. And then we compared them, we prompted them to remember the soul's hug with this video of Cosmic Nebula. We called it Transcended Soul Listening Meditation, Connection to Your Cosmic Soul, and compared it to exposure to digital art by Refik Anadol, another transcendent experience, something larger than yourself, art, or nature videos of US natural parks, national parks. And as you see, the national parks stimulate this posterior occipital lobe, mostly immersion, reflecting mostly immersion in this flood of beautiful nature videos. In the cosmic soul and art exposure, we see a similar distribution in the processing areas that process this and analyzes this connection or analyzes this impact of the art exposure. So all in all, resilience and brain health across lifespan are important targets for treatment and prevention for mental health, cognitive disorders of later life. The earlier you start, the better it is, because children will then have lifelong skills to promote dealing with stress and trauma, and their resilience, but also brain health. And putative mechanisms I explained, you could personalize and select mind body medicine practices that are more acceptable to a particular individual. Neuroimaging and peripheral biomarkers can explain underlying mechanisms, and technology and AI can help personalize approaches to brain health and enhance self-regulation. So I have a lot of support, grant money, but also my students wrote a lot of books and presented it at various conferences. Thank you.